series. All right, thank you, Zoom, and thank you, Dr. Bahar. We are so excited to have you and be with you once again this month. And this month, the month of April, our topic is equitable care, integrating social determinants of health in medical education, healthcare, and public health. I am, as always, your lovely and effervescent hostess with the mostest, Dr. Para, pronounced she, her, and all, and the director of HEJIM, as well as multiple other health equity and health justice initiatives, both here at Wayne State and Detroit Medical Center in the city of Detroit, nationally and internationally. I am excited and proud to present this topic with two of the most amazing people that I know. Period. And that is the illustrious Dr. Claudia Richardson, who is also the medical director of the Detroit Health Department and is an incredible leader in medicine and healthcare, period, just nationally, and certainly here in this great of beloved city of ours. And the amazing, phenomenal Mr. Melvin Bishop, who is a community health worker with Wayne Health as part of our exemplary mobile health unit. So you're going to hear from them in a minute. But first of all, we're going to do our usual intros. And I'm going to provide an overview of the topic and then bring in our speakers. So as always, we start with acknowledgments. And so we acknowledge that the U.S. is a settler colony. We acknowledge that we are in the city of Detroit, otherwise known as the territory of Wawiatanong, the original homelands of the Three Fires people, the Anishinaabe. And we commit to honoring and respecting this land and the diverse indigenous people that still are on it. And we acknowledge our ancestors, in my case, my African and diaspora ancestors who lived, loved, and labored that I may exist and thrive as a free Black African woman, and you all as well. And of course, we acknowledge this great city that we are truly humbled and privileged to learn from and work with. We are always open and sensitive to what's going on around us in the world. And we know that many of us here in the DMC in Wayne State, we represent all parts of the world, many places that are thriving and flourishing, and many places who are going through challenges, whether it's conflicts, war, and other unrest. And for that, we want to lift up peace and justice and stand in solidarity with our colleagues who are often frontliners in these very places. I want to remind you that here in HEJIM, we do have multiple community engagement and research and quality improvement projects opportunities. So please reach out to me if you have any interest. These are some examples for you. And we have our monthly newsletters that we are still looking actively for contributions. So please go ahead and reach out to me, Dr. Bahar, if you can put my email in case someone doesn't have it for some reason at this point. I think all of you should have it. If you know, because again, we want to get your contributions, your ideas, your thoughts. If there's any activity or individual or program or effort that you want to highlight, we want to celebrate and highlight those programs here, whatever it might be. If you have some thoughts or ideas for the newsletter, go ahead and send that to me. We want to spotlight the work. This is a QR code for our March sorry, not March, our December issue. We do have later ones, but if you haven't been receiving them by email, feel free to look at this as an example. But we'll be sending out this month and last month this week. We want to recognize that in this month of April, there are a few things we're celebrating. So first of all, if you are celebrating your birthday this month, go ahead and put it in the chat. Happy birthday to you. We wish you a long, prosperous, amazing, fruitful, and abundant life, okay? And celebration up the wazoo. My second daughter, who is turning on Wednesday, she's turning 9. And so I'm very grateful for that. And we already had a celebration over the weekend. We'll have another one because she's a diva like that and deserves multiple birthday celebrations. But anyway, If you are celebrating your birthday in April, shout out to you and happy birthday. April is also National Minority Health Month, as well as National Public Health Week. That was earlier this week. National Black Maternal Health Week was also earlier. I'm sorry, earlier this month, the 7th to the 13th, and Black Maternal Health Week was the 1st to the 17th. So, again, we acknowledge all this alcohol awareness. I'm sure for those of you on the floor or even an outpatient, you are taking care of people with alcohol use disorder. Being aware that of this of the challenges that as presented by alcohol is very important, so you can have those informed discussions with your patients and people in your life. It's also stress awareness, honey. And every single one of us can relate to that. So, how do we build our resilience? How do we build healthy coping mechanisms and behaviors? This is a very important month to get it together. We want to recognize the Arab American community, the autism community, those who are survivors of sexual assault, the deaf community. We want to raise our awareness around fair housing and financial literacy this month. So even as we're closing out the month, if we were not aware of this, it's a good time to build that awareness. And just as a reminder, that National Minority Health Month theme is advancing commitments to eliminate health disparities. And HEJIM as a whole fits into that theme. That is, we are about this life every day of the week, of the month, of the year, certainly. And definitely our topic today absolutely is advancing commitment to eliminate health disparities. If you want to learn more about National Minority Health Month and the toolkit from last year, I wasn't able to find this year's toolkit. I think we can imagine why, but you can go ahead and click on that QR code. So as always, we encourage engagement. I know we multitask and are busy, but I want to encourage you to give yourself the gift of this time to just sort of, learn something new and be exposed to new information, new knowledge, a community, even though it's virtual, that really will infuse you with this extra energy for the rest of the day and the rest of the week and the month till we meet again next month, right? So, and feel free to engage in the chat, provide questions, comments, feedback, share resources if you have any. Ignore this CME number. This is not accurate, so please ignore that. And the QR code is for our YouTube list for previous lectures if you do want to, help yourself to those lectures. Dr. Bahar has reminded me that we really need you to fill out your evaluations. We're going to be submitting that link. It's short. It's nothing. It will take you all of 2 seconds. So I want to really encourage you to please help us out. This is how we keep our CME accreditation, shall we say, is by your feedback. And also, more importantly, it helps us get better. Okay. And we're always in the business of wanting to get better. So please fill out those evaluations. We're going to post it throughout the session. It's really important for us. So let's get into the topic of the day. What are objectives? We're going to define and provide examples of social determinants of health. We're going to outline the impact on health outcomes and experiences. We're going to talk about how we integrate it into teaching, clinical practice, and public health. Let's start with a case that's based on real life. Some of you may already be familiar with this case, but all my cases are based on true story until otherwise specified. They're all based because way too many experiences and stories that are based in real life to make anything up at this point. I wish I could, but hey, here we are. So we have a 66-year-old woman. She came, I was admitted for acute COPD group E exacerbation. And I understand that not all of us might have a medical background. So I'm going to interpret or rather translate this language to make sure that all of us are on the same page. So a 66-year-old woman comes to us because she's having difficulty breathing. She has a condition known as chronic obstructive pulmonary disease. It's a very serious lung disease that can make it very difficult to breathe. And she has a severe advanced disease, and she needs oxygen at home. This month is the 8th time she's coming for this disease, having a flare. Okay, in a 8th time in a 1 month is really bad, and she has come in multiple times throughout the year. She's very, very thin. She's frail. She has dry skin. She's actually on the right medicines, and she takes her medicines regularly. When she comes into to the hospital, we see that her blood pressure is high, and she is not really keeping a lot of oxygen in her, and requires a lot of additional oxygen for us to give her a lot of oxygen, additional oxygen, so as to have the adequate oxygen she needs to stay alive. Okay. So I want us to think, because of our time today, I'm not going to have you to, on mute, but I would say in the chat, I want you to use the lens of health equity as far as you know and what you're comfortable with. What are your thoughts on why she keeps coming in so frequently to the hospital? And what additional questions would you like to ask? Okay. So start to think about that, but use the lens of health equity. All right. Well, I would tell you, because we, are health equity focused, we are health equity clinicians. Okay. HECs in the building, health equity clinicians. Yeah, yeah. Okay. We immediately, we've already made sure that the medical pieces are where they need to be. So now we're going to look at her what social determinants of health. We find out that she's essentially homeless, right? She's unhoused. She lives on the couch of a relative. She's chronically exposed to smoke because a relative smokes and doesn't want to quit. She's a retired teacher. She lives on a pension, on Social Security, and disability, and every month gets about $1,000, which I hope you know is barely enough to live these days. She's not able to follow up with the lung specialist, which she does have one assigned, but because of transportation issues, she's not able to see them. And the summary of these other screeners essentially finds that does have moderate depression. She has high stress, and she has a history of childhood stress, trauma that is also has impacted her vulnerability to developing a chronic disease. And so I want you to think about, as these social determinants that we have identified, how has that changed your differential, your evaluation, or your management? And the key thing about it is sometimes, when we're doing our morning reports and other presentations, we list the social determinants of health, often as if there's just sort of like this parallel, unrelated thing that you have to report. But anyway, back to the medicine. And again, I want to really challenge us that, medicine is inherently social. The social factors and social context and social determinants is the medicine. Okay, it is. The care is incomplete without taking social factors into consideration as you're thinking through the evaluation, as well as you're thinking through the management. And so social history is not just about tobacco, ETOH drugs, right? TED, tobacco, ETOH, alcohol, drugs. It's more than that. It's the larger context, which we'll talk about. So the basket in which this lives is in this basket of health equity. And what is health equity? It is the assurance, right, of the condition of optimal health for all people. It's not just about where we're going to, is how we get there. That all matters, right? And when we talk about equity, right, is to be assured that all people get what their optimal health. And to do that requires valuing everybody equally so that no one feels or is marginalized, invisibilized, undervalued, or disposable. That we recognize that people don't are not in an unhealthy situation by magic, but that truly it's because of historical injustices. And so we have to recognize that and then work towards correcting it, rectifying it, so that we can actually impact the reality of people's lives. And thirdly, it is providing resources in the spirit of that according to need. Not everybody's going to need the same thing. There's no one size fits all, but according to need and context is what resources will need, is how need resources will need to be provided. So we don't talk about equality. That's an outcome of equity, right? But equity is not the same thing as equality. Equity gets us to equality by ensuring that we are meeting people where they are and everybody is not at the same place. And so knowing that helps us to understand that health disparities are not by the accident. So when people often talk about what the healthcare system is not broken. The healthcare system is acting as designed. There are decisions and behaviors and machinations at play that result in the healthcare system that we have. And through action or inaction, this is where we find ourselves with unequal outcomes, which we call health disparities. So these are not acting in a vacuum, but they're historical and they're contextualized and they are. But the good news is that if we can make them, we can unmake them. So they are preventable and what they are reversible. So that's where we talk about social determinants of health. These are the conditions in which people live, work, worship, school, grow up, employment, education, all those things. So we talk about economic stability, neighborhood and physical environment, education, food, the community, safety, social context, and the healthcare system itself is a social determinant. And through decisions where, because of the historical foundation of the nation of racism and discrimination, it does then result in differences in employment and income and debt and bills and housing and transportation and literacy and language and early childhood foundation and food security or not, social integration and stress and safety and trauma, healthcare coverage, the type of doctor or pharmacy or dentist, and the quality of care people result in. And all of those things result in impact health and well-being. It impacts how long we live, if we live or die, and if we live, how well we live. There is a movement to start to even sort of like frame these things as vital conditions, right? Again, in the spirit to make sure that there's not this sense of, well, you got healthcare over here and then you got the social over here. They are one and the same. And so this is a QR code that sends you to a website where this is outlined, that the AAMC has been a leader in these conversations, right? So reliable transportation, a thriving natural world. So it expands this idea of what are the determinants, of life? What are the things that impact our lives, right? As well as our health and experiences of illness, right? A thriving natural world impacts our health, right? If our water and our soil and the air is unhealthy and unsafe, we ain't gonna be healthy or safe either, no matter what, right? Whether our basic needs are met, whether we have humane housing, whether we have work that is meaningful, whether we have access to building wealth, lifelong learning, reliable transportation, like I said, a sense of belonging, and the ability to exercise our civic muscle through voting, through engagement with our political process, etc. Okay. So again, this is not by accident. And why does this matter? It matters because it literally is an issue of life and death. Here in the city of Detroit in Wayne County, we have Black residents that are dying before their time, up to 20 years, really, but on average 5 to 15 years earlier than their white counterparts. Right? This is an injustice. So let's look at where we are. We are around here. If you look at this map with this first circle, right? The Wayne State area 48201. The average duration of life in this zip code area, length of life, is 69 years. Okay, in Wayne County, it's 75 years, but in our specific locale, it's around 69 to 72 years, right? Just 2 miles up the road in Grosse Pointe Shore, the lifespan increases to 82 years. So we talk about your DNA is more important than your DNA. Where you live is going to impact how long you live and how well you live than anything else, right? Than anything else. We talk about the ways, the percentage of how the determinants of health impact, right? So we say that social determinants of health, they impact 80% of outcomes. 10% of outcomes is the clinical care, 10% is genetics, and the rest are social determinants. That's up to 80% of outcomes. So this is why it's so critical that we are centering in our work social determinants of health. That is not just about the medicine and that and this, which is important, but it's just a sliver of the impact. All right, I'm gonna be very quick here because you can access all this data, but just to lift up that where we are here in the city of Detroit and in Metro Detroit, we have significant adverse social determinants that impact our communities, right? So we have a persistent wealth gap, we have unaffordable housing that is very significant, and there are racialized disparities along those lines that are again structural because of who is allowed to access loans versus not, or even for housing, but also for businesses. We have um, again, because of the structural reason, redlining, the GI Bill, which is a bill that gave land and free education to veterans coming back from the war, but that was not given provided for Black, veterans as white veterans. So again, some people get ahead up than others. The lack of reparations after over 250 years of free labor, to build this country, building I-375 to decimate Black communities and disrupt their ability to develop wealth, and therefore health. 8 Mile wall to, again, for redlining, to physically segregate communities and not allow them to access health. All these things result in outcomes, right? And so we have here the 10 leading causes of death from 2022 from Detroit Health Department. You can see heart disease, cancer, accidents, COVID, stroke, and the list go, chronic lung disease, and the list goes on. Um, and we see here again that I have significant racialized disparities with Black folks having poorer health outcomes, right? When it comes to those leading causes of death. But again, those are all linked ultimately to those social factors, right? Five major health needs by Detroit residents: living wage opportunities, affordable housing, financial wellness, safe and decent housing, before and after school programs. And then in Wayne County, similarly, as well. And from the 2018 community health assessment, again, high rates of, compared to the rest of Michigan here in the city, high rates of unemployment, but we do well when it comes to graduating. Well, did not graduate from high school. We do have high rates. Transportation issues, poverty, internet access, and again, housing instability are high here, as I'm sure you all know. And also, we are a location for environmental injustice with high rates of asthma, lead poisoning, cardiovascular disease that are linked to exposure of pollution. All right, with 48217 being the leader in the state when it comes to this. If you want more information, I was really honored, along with Dr. Richardson, Dr. Riddle Jones, and others, and Dr. Bagdasarian, our Chief Health Officer for the state, to present a State of the County address in March of this year. You can use this QR code to access it, and we share a lot of this data, as well. So you can feel free to check out more. But there's one thing I want to point out before we pivot to our other speakers is a very powerful quote by one of I call her my big sisters, and I named my third daughter after her, Chimamanda Ngozi Adichie. She has a new book that has come out. Is this quote? The single story. And she has this wonderful talk. You can go on YouTube. It's a TED talk that is called The Danger of a Single Story. And what she talks about is the single story creates stereotypes. And the problem with stereotypes is not that they are untrue, but they are incomplete. And they make one story become the only story. And so the consequences that erodes people of dignity, it makes our recognition of our equal humanity difficult, and emphasize how we're different rather than how we're similar. And so what I'm use that to say is that when we talk about social deterrence, it's not only about the adverse or disadvantageous qualities, all right, determinants, not just about the adverse, but also they're about the advantageous. We have to talk about the both and. So they're negative determinants or detriments, but then they're also protective or advantageous pieces. So here we talk about what do Detroiters say are important to their quality of life, knowing what hearing the voice of the community, because whoever is most impacted has the answers. We don't always have the answers. They rarely do, but people who are most impacted are the people that have the answers. So from the 2018 community health assessment, they talk about they want grocery stores, they want schools, public transportation. So folks know what they want and what they need to live a long, better, fulfilling life. And using art and pictures, they draw it for you, the children, the young people do, right? And you can see here, if you can see the screen, the questions: what does a healthy Detroit look like to you? You see here beautiful green, there's green meals, there's beautiful neighborhoods, ability to ride their bicycle, recycle, healthy food, sports, activity, etc. So folks know what they need to live the life they want to lead. And in that 2018 assessment, by the way, there is an ongoing assessment to update that data currently right now. And that's, I think I have a QR code for that. You see what the community health goals are. Why is it important to know? So that when we are building our goals, we can go ahead and make sure that they're in alignment with the goals of our community, right? We can be talking about, yeah, we want to, XYZ, and it has, and but the community is like, nah, our main goal is to improve the health and quality of life through strengthening education and economic policies. We have to make sure that if our passion and our expertise is hypertension, how do we tie that into strengthening educational and economic policies? Because that's what the community said they want. That's their primary goal. So it's important to know the goals of the folks that you're working with so that you can go ahead and tie it into the work that you're doing. And again, these are just other ways to again celebrate the beauty of our wonderful city, right? Whether it's sports, whether it's Belle Isle, there's so much beauty and awesomeness in this city. There's a great history, and you can use this QR code to who we are as the city of Detroit and Metro Detroit and how we contribute not just to the state of Michigan, but the world. And again, there's even more. And knowing this and grounding ourselves in the beauty of our story, our history, and who we are absolutely strengthens the work that we do in addressing social determinants of health. This QR code connects you to Detroit for Life program as part of the city of Detroit to see what are these larger, wonderful programs that address, again, strengthening our communities so that we are less vulnerable to illness and poor health outcomes and better health outcomes instead. I was going to tell you a story and sort of use my family as an example, but I think I'll save that for another time because I want to bring in our speakers. If you have any questions or reflections, please go ahead and make sure that you're busy in the chat. But this is my daughter, my first daughter. She's 11. And I was going to tell you how social determinants of health affects us all, and it definitely impacted her. But also we talk about not just, again, this is an example of the adverse and advantageous, but we also talk about the protection of where social determinants of health are protective, and really naming what those are, and using my own experience as well for how my social determinants of health that have been adverse, but also advantageous in order to help me with managing my own health. So I will tell you about that another time. But what I want to do here is round up my comments by lifting up this very important piece. I now, in my talks and teaching and writing, talk about SSDOH, which is structural and social determinants of health, because structures are the root causes, are the roots that uphold the social. Okay, what are structures? The policies, the economic systems, the social hierarchies, the politics, the commercial, the capitalism, all those things, the isms, right? They're the ones that inform whether or not we do have affordable housing or not, whether we have affordable, reliable transportation or not, whether we have well-paying jobs and a living wage, etc. All those policies, those are the structures that uphold those conditions in which we live, work, and school and play, etc. And that's what impacts our health outcome. So that's why I believe it was February, we talked about structural competency. We need to understand not only that housing, for example, is a social determinant and impacts health, but what are the policies around affordable, humane housing that allow for those to even exist in the same way? And that again goes to the structures. So understanding social determinants of health and the structures, structural determinants of health matter. And then I'm just going to quickly talk about this because it's important. So, right, what can we do today, right, in knowing this? Well, we need to do better in screening. We need to be asking the questions of social determinants of health. We have a few validated tools. The one that is right now in the Detroit Medical Center is Prepare, okay? And it's already in your center and Citrix. Inpatient social workers, like case managers, are using it. We are starting a project where we can start doing it our own outpatient, okay? There's also other validated tools. This is the Center for Medical and Medicaid and the Everyone Project, that can be used as well. But we are going to be using Prepare and start working on how we do that outpatient. This is an example from one of my patients currently. that the social worker went through. And again, using prepare and ask all those social determinant questions. You want it's in the center. You can look at it and use it and incorporate it into your care plan. And you can document your SDOH. There are Z codes for that: health literacy, physical environment challenges, housing issues, child financial, etc. There are Z codes from Z55 to Z65 that should be documented, because these are things that we will be tracking. Okay. And then when you get a positive screen, what are you going to do about it? Well, you can connect them to resources using a variety of tools. And so one of those tools, I just lifted three here that are popular. The Neighborhood Navigator as part of the Everyone Project. You see a QR code there. You have findhelp.org. That's the QR code there. Formerly known as Amberta, and 211 United Way. This is a QR code there. So these are tools that you can use to connect your patients to resources when you do identify a social need. You all know about our social health task force, which is our resident project initiative arm from HEJIM. And so the card initiative is ongoing, where there you have the lanyard and the QR codes that connect you to resources that you can offer your patients. And again, we're going to start the SDOH screening protocol soon. Shout out to Dr. Hong and Dr. Joshi for leading that work. Okay. And then in the GMAP clinic, you can always holler at our good friend, Miss Rachel, and our case managers and social workers who are also wonderful resources. And we're hoping that we can start to integrate community health workers into our clinic as one of the resources to support us as well. And so here is the tools for the card initiative that connects to a variety of resources as well. Okay. All right. We're going to pause there because I think it's a good place to pause. And thank you for your attention so far. And I want to bring in Mr. Melvin Bishop real quick. Actually, what I want to do here is, Mr. Bishop, are you okay pausing and let's talk to Dr. Richardson first? Because Dr. Richardson has been so amazing and kind. She is traveling and she's in the airport. And I asked her to speak, and she said, yes, I will pause my travels in the airport and be here to teach. And so, Mr. Bishop, are you okay with Dr. Richardson going first?
That's fine. That's fine, Dr. Barrow.
I appreciate you, my wonderful brother. And so I want to introduce to you Dr. Richardson. She is the medical director for the Detroit Health Department. She's also a leader of public health all over the state of Michigan, frankly, and beyond. She's OBGYN, board certified OBGYN, and she's also a leader on our Detroit and race-based medicine task force. I'm very proud to call this wonderful queen, a senior sister of mine, a mentor, and a friend. And so with that, I want to welcome Dr. Richardson, who is going to talk about briefly with us the intersection of healthcare and public health as it relates to social determinants of health here in the city of Detroit. Dr. Richardson, who is coming live from the airport. Dr. Richardson, which airport are you at?
Actually, I'm in Detroit Airport because I'm leaving later today.
Okay. Oh, I see. Okay. I was under the impression that you were arriving, but you are departing. Either way,
Yep.
we're very honored that you took the time, regardless, to be with us. So please, the floor is yours.
Thank you so much for this opportunity. Can you hear me okay, first of all?
Absolutely.
Perfect. Just thank you for this opportunity to meet your residents and just to be in this space. Always want to take the opportunity to share more and learn more, especially with residents. So again, I'd like to tell you all a little bit about myself and about my journey, which may explain my perspective on many things. As Dr. Paris stated, I am an OBGYN. I am from a rural area, and I wanted to bring that out in case we have some providers that might end up in a rural space somewhere down the road. I'm from rural northeastern North Carolina, and I actually came to Wayne State to train over 30 years ago at Huxell Hospital, very urban. So where I'm from, however, is a very socioeconomically challenged area, just rural. And then, of course, I trained in Detroit back in the 90s. And also, there were some socioeconomic challenges in many, not all, of the patients that we saw, probably very similar to what your experience um, there in Detroit. And then I returned back to North Carolina for practice. Then I moved from that sort of interaction. I was in private practice on my own practice, saw that one-on-one patient. I saw a doctor saw one patient. That was my patient, and then my panel were the patients that came to my practice. Then I moved on to become CMO of a couple of FQHCs through the years, and then my patients became, yes, the people I saw one-on-one, but also the patient or that population within our medical practice. So I not only watched my patients, but the patients that all of the medical providers were seeing and looking at how our patients were doing, that population was doing. Well, now I look at my role as medical director in the Detroit Health Department as every citizen in resident of Detroit. They're all my patients, looking at work from a population standpoint. So, of course, when we're looking at how our populations, whatever that population is doing, we also have to try to figure out if there are any barriers related to that. And that is kind of where social determinants of health comes into play and our concern about it. If you think back to um, when you did your training, probably in medical school, around the concept of empathy as a medical provider, not sympathy. I remember that very very clearly how that difference was explained to me, and how we have to put ourselves in someone else's shoes to sort of understand what's going on. That concept right there will help you understand why your patient may be challenged the way they are if they're struggling. And that is a tool, and your ability to consider that when you're seeing a patient will help you through your year. Um, Being able to put ourselves in someone else's shoes makes us stop. When we're looking at that patient that might be um, not able to keep all of their appointments, or that patient who might not be taking their medicine like they're supposed to. That empathy, if we can stop for a moment to think, what is it? Is it transportation? Is it they can't afford their medicine? What is it that's keeping them from being able to follow through? Is it that, one of my biggest concerns, especially in women, is it that they're overwhelmed with life circumstances that they're trying to manage for themselves and their family, and their frontal cortex is not working so well? They're overloaded. They have CT, uh, chronic stress disorder, any of those things. So being able to put ourselves in in the place of or trying to figure out what might be going on with our patient, instead of, as you all know, applying blame or being judgmental. None of us would do that, but that will always help you. In public health, and well, first of all, so in trying to understand those challenges, whatever we can do in regular medicine, in the medicine where you're seeing the patient in front of you, or population based medicine, we try to find ways to reduce barriers. And I think if you can always just try to get yourself to think empathy, what's going on, and what can we do to reduce the barrier or remove the barrier, um, again, is what's really needed and what will be helpful. In public health, one of the most we one of the biggest tenet with public health is prevention. And so if we can prevent a disease altogether, or prevent spread of disease, or prevent um, complications of disease, we want to do that. And of course, SDOH affects all of that. And we try to think of innovative ways working with you as medical providers and working with external agencies in trying to first figure out the research, public health does research, to try to figure out what are the barriers for real, what are really the barriers. And then what innovations can we develop to reduce or remove those barriers? And my challenge to each of you is this. Um, when you run across situations where you might have the opportunity to uh, make a change, please think boldly. Innovation is so important in doing SDOH work, thinking out of the box, trying to get the patient to the service or the patient to the treatment by any way that you can, and not just traditional ways all the time. I'll share one situation in the city of Detroit that we're very excited about that is, to me, very innovative to reduce the barrier. Um, we know that maternal mortality in the city has been concerning for many, many years. And one of the barriers we know is transportation to appointments. And so the mayor felt very strongly about that. And we now have the program of Rise to Care. I hope that most of you all have heard about that program where moms can get to doctor's appointments when they're pregnant, and also they can take their children to medical appointments until they're 1 year of age. That is an expensive and a very bold project to say that anyone in the city of Detroit who needs transportation to a prenatal visit can get one by calling one phone number. But it does indeed remove barriers. Mothers, just think about it. We can look at a mom and be judgmental by saying that they miss prenatal appointments. So what if you were the primary breadwinner and you have to take a bus and you might have to take 3 buses or 2 buses to get to your doctor's appointment, and you miss a day of work and you have 3 kids and you're the only breadwinner. Rise, some mothers chose feeding their children over prenatal appointment. So we want to do exactly what I stated, which is to reduce the barriers. So perhaps they can go to their doctor's appointment and go back to work and meet their family's needs. Another area of concern. So where we of course deal with SDOH is, we're doing a lot of work in the city around Narcan treatment. I mean, Narcan administration and getting Narcan into the hands of family members. So of course our behavioral health team actually goes around the city, looks for encampments of people who may have substance use disorder, and actively looks for people who might be in need of Narcan treatment right away. But they also, for the next prevention level, go to hotels. And most recently, we have harm reduction stations where anyone can go and get Narcan out of a vending machine. Again, no pharmacy, no reducing barriers. It's getting it as close as possible to the person who needs it and to family members. So we want hotels, we want you to have Narcan in your car or in your purse, so that we can help save a life. I think I'll stop there, Dr. Opera, and see if there are any questions.
That was fantastic. Absolutely. Thank you so much. And if you have any questions, please go ahead and put in the chat. While you're thinking about it, I just want to thank you, Dr. Richardson, for that. Those were two wonderful examples, and that's just two of many. I encourage you to go to the DetroitMI.gov website, and you can find out more information about what's going on in the city of Detroit, as well as the health department. I put the link to the Rights to Care program, and Dr. Richardson, we feature the Rights to Care program in our, I think, January or February newsletter. I'll repeat it again in this month's newsletter because since you brought it up, so in case you all did not catch it, you can catch it now. So thank you for sharing that. I just want to really appreciate just the emphasis on the fact that, SDOH is critical, not just in management, but in prevention. And just really lifting that up and reducing barriers in order to prevent, if not the first incident, then at least recurrence. I thank you also for lifting up this concept of empathy and sympathy. And there's a video I really like. It's very short from Brene Brown, who is a popular speaker and a teacher and author. And it's empathy versus sympathy. I put the link in the chat as well. It's a very short YouTube video that beautifully highlights the difference between the two. But we want to be empathetic. We want to be with people in their experiences. And finally, I appreciate the reminder to think boldly. When we engage around social determinants of health, what are bold ideas for solutions? I'm proud to share that some of the thoughts that we've had boldly is applying for a grant to be able to hire a community health worker. But while waiting on that, I'm working on partnering with community partners in order to see about working with those partners that already have community health workers, but they're looking for a site. Can we be that site where their community health workers can work while providing them the opportunity to do that work and connect our patients to resources? So those are some of the bold thoughts, or at least early bold thoughts that we are percolating and working on. So thank you for reminding us to be bold. Any questions? Any questions? Yes, thank you. Dr. Richardson also put in the chat the DHD wants to support us. So please contact her. The number is 313-580-8747. I put your questions in the chat, your comment, feedback, but I will allow for one person, one verbal, if anybody wants to unmute and has a question before we go to Mr. Bishop. All right, let's go ahead and go on to Mr. Dr. Richardson. Thank you so much. Feel free to hang out till you gotta go. That'll be great in case somebody, gets inspired later. But if whenever you gotta jump, you gotta jump, and we respect and really appreciate you taking the time. It is my honor to welcome this amazing gentleman, Mr. Bishop, to this space. I met Mr. Bishop while working with the mobile health unit as we were building out our social determinants of health efforts. Mr. Melvin is a community health worker and has been one for years. He's one of our he stood the test of time here at Wayne and fantastic, does impactful work in the community. And I'm just really proud to know Mr. Melvin. And I picked up the phone and he said, I got stuff to do, but for you, Dr. Parra, I'm here. And I'm so blessed to be able to have that kind of relationship with an amazing person like with Mr. Bishop. Mr. Bishop, you're welcome to the space. Thank you for making the time. And I would like you to go ahead and share a little bit of your story and how you got to do the work that you do here with the mobile health unit here at Wayne. What does that look like? But also, before you even get into that, just sort of helping us understand what a community health worker is, because many of us, believe it or not, don't know what is a community health worker. But if you could use your story of how you got to be a community health worker here at the Wayne Mobile Health Unit to also connect us to increase our understanding of who a community health worker is and what they do, that would be amazing. The floor is yours.
Okay. Thank you, Dr. Parra. Again, my name is Melvin Bishop. I'm a community health worker assigned to the Wayne Health Mobile Unit. And after retiring from the Detroit Public Schools, I got connected with with Wayne State hypertension, and they said that Dr. Levy was creating a platform where they were going to have a mobile unit, and one of the positions was a community health worker. And so I didn't know what it was, and I was like, well, I had been doing some other things, but I wanted, it caught my interest, right? And so I decided to investigate it, and then pandemic happened, and then we were scheduled to go to one of the local community colleges, but everything was done online. So we completed the course. I completed the course, and then I was assigned to a mobile unit. And so it's been my pleasure to assist the community with some of the resources that they needed. And it was an eye opener because it gave me an opportunity to see some of the gaps in healthcare. And so one of the things that I enjoy doing is helping people and resolve some of the issues that they have. One of the things that I'm tasked to do when I'm on the mobile unit is that when we go to different sites, my job is to drill down and find out social determinants of health issues that from the people that we see. And it's we have a questionnaire from mental health to food deprivation, transportation, to housing. And so each one of those questions that I do go over with the patient, it gives me a bigger, gives me a more of an insight of what they really need. Sometimes folks just want to come and they just want to, no one has actually listened to what their needs are. They know what their needs are more than I do. I just use my my position as a conduit to help them attain some of the resources that they need. And so when they come and I go through the social determinants of health questions, I can pinpoint exactly or close to what they need, and I'm not judgmental. Everybody has life experiences, and everybody have issues that sometimes they're open about, and sometimes there are issues that they're not so open about that they want to share. My job is to make sure that I provide an atmosphere where they can talk freely, and I let them know that everything that we're discussing is private, and that it won't be shared with just anybody. And we want to make sure that I give respect to the people that we see, because everybody's entitled to respect. And so there are a lot of different things that I'm involved with as far as the resources. If they need transportation, I do have access to what we have is bus passes, and I generally will give them some, but I'm not in the business of giving them, making it whatever, whenever you need transportation. I can provide an appointment date with one of our doctors. And then what I'll normally do is I will follow back up after, let's say I'm having an appointment. A person needs to have an appointment to see a doctor or primary care. I would generally set up a time where I will either call before or after to see how did it go. And I don't want anybody to be missed from the safety net, because that's what we're providing, is a safety net, and finding out what are the barriers for folks getting healthcare, and so calling back sometimes what I gave them for a resource was successful. Sometimes I have to go back and we'll go another route. We'll find another resource. But I always wanted to make sure that they have the ability to call me, and we can move forward in getting the issues resolved. I love success stories, and so that keeps me motivated, and that's what drives me when I can speak with a person, find out what their needs are, get them the resources that they're looking for, and then follow up for a conclusion. And so that that is pretty much what I do with the mobile unit. The other day, I had a young parent, two young parents. They had young kids, and she was actually pregnant again, and so they wanted a resource to for diapers. So I was able to connect them to a resource where they were giving free diapers. And as you know, when you're young and you have young kids, all of the resources that you can get is a good thing. And so those are the type of things that I do for the community, for the people that we see when we're in the mobile health unit. We're all over the tri-state of Michigan, and so my job is to make sure that they find the resources and they feel comfortable and with me, and be able to request certain things that they may not ask for people who they don't know. And so I think it's a privilege for them, for those folks to come and just talk to me openly, and and that's really what's missing out here. So many people, when they're in a low point in their life, people don't necessarily respect them, or they are looking at them like, why are you living like this? But life happens. And so you have to be able to have sympathy and empathy in your heart to help someone else. And that's how I was raised, always trying to help. And so I think I had to credit my mom for that. And so that's what I do as a community health worker.
Thank you so much, Mr. Bishop. That was powerful, and um I really appreciate your stories. The stories are impactful when you share the story about the young parents. And okay, thank you. And I just want to shout out Dr. Bahar. Thank you for helping with managing the inflow. We do have a resident that wants to come in, so please go ahead and let them in. Um, Mr. Bishop, I also thank you for Mr. Bishop. Do you mind muting briefly, and then only when you're speaking? Thank you so much. Only because of oh, you know what, the
I
back
muted.
is not
I
coming from.
muted.
Yeah, there's somewhere else. I'm sorry about that, Mr. Bishop. It was someone else. Okay. In any event, yeah, no, thank you for that share. And again, I want to encourage folks, please put your questions, comments, reflections, feedback in the chat for Mr. Bishop. But Mr. Bishop, I do have a question. And again, thank you for helping us understand what you do as a community health worker. Community health workers are the
Yes.
backbone of the public health system, and we're evolving to incorporate them in healthcare itself. Um, I guess my question is like for those parents that came in and didn't have resource, I'm sorry, diapers. How did you find that program for the free diaper? What was your process for that?
Well, the process was, I was familiar with that. It was one of the sites that we actually visited, and so every site and not only just for the diapers, but for every site that I go to, I investigate exactly what do they provide to the community. That particular site for the diapers, we have done that site a few times, and The more you do this, the more resources that you can obtain on your own, and not just a booklet. Although I do have access to certain certain sites that provide resources for individuals. That one there was a resource that every third of the month they give out free diapers. And so when the young man and the young lady came there, I knew exactly where what they needed and where they can obtain it. And he had been past the site, but he just never went in. He didn't know what it was for, and it was almost in his community. And so that is one of the resources because I've been there before and I knew where it was there. But I also, when we do get people that come to our sites, or if I'm assigned somebody, I always give them, like I saw on one of the slides, Find Help Mid-Michigan. That is an excellent site. It has different sites that you can go to for different resources, food, housing, you help with utilities, all those different types of resources. So I do share that with them and let folks know, check that resource out. You may find something, if not what you're looking for today, something down the road that you may use.
Absolutely, or for somebody else in your community or in your neighborhood.
Absolutely.
Yeah, yeah. And so for everyone, I have been putting resources, actually, both of us in the chat. The CHW toolkit from the CDC is in the chat. The Wayne Mobile Health Unit, if you want to learn more, is also in the chat. And then the website for findhelp.org, mi211.org, the Everyone Project Community Navigator is also in the chat. So there are ways to find resources. And one of them, I want to also note, Mr. Bishop, one of the best resources is just you, because you're from here. And so you have the wealth of knowledge of the community. So that alone
Yes.
is I mean, is invaluable. And I also appreciate something that you said. You said that there were resources in their neighborhood, but the young man just didn't know about it and would walk by it. So it's amazing the resources we have right under our nose, right where we are, but we just are not aware. And so it's beautiful when we get that, folks to open our eyes to learn more about what is right where we are so that we can connect to it. So I appreciate you. I appreciate Dr. Richardson. Are there any questions, any comments, any feedback? You all engage around social determinants every day, all day long. You have challenges that you experience. I know it because I'm part of it or I hear about it. So this is a wonderful time where you have, the community professors, as I like to call them, the folks who know because they're on the ground, they're out of these four walls, they're the boots on the ground, they have the lived experience and expertise, and they're great resources. That's one of the reasons we have community, presenters for HEJIM, to know that the expertise is not always in these four walls. The expertise, most of it actually lives outside of these four walls. So any questions, any comments, any remarks? You can unmute or you can put in the chat. We'll wait a couple of minutes before we round up. Okay, well, I guess all your questions were answered and all your knowledge cup was filled to the brim. So before we say bye-bye, very, very important again to remind you, please fill out the survey. It is critical for us. And you know what? Encourage one other person to fill out the survey. So that's the homework for everyone. You fill out the survey and text or WhatsApp message, call your friend, your colleague. Hey, did you fill out the HEJIM survey? If each of us fills out and reminds one person to fill out, that will help us tremendously and help each other so that we can keep this program going, having amazing people like Dr. Richardson and Mr. Bishop here to help us be better physicians and just better people, better humans in the world. So with that, I want to thank everybody for your time and for staying on. And again, reach out to me if you have question, needs, what have you. We have shared a ton of resources today to help make your work easier as you do the great work of being a fantastic, phenomenal physician in our beautiful city of Detroit. Have an amazing day. Have a wonderful week, a fantastic month that's about to round up as we enter May. Enjoy the sunshine, enjoy life because it's beautiful. And I look forward to seeing you next month. Thank you. Thank you, Mr.
Thank you, Dr.
Bishop.
Parr. All right.
Thank you. Thank you, Dr. Richardson.
My question wasn't answered. Dr. Parr. Dr. Parr.
Man, you was